Good afternoon, everyone. I think it's now afternoon everywhere in the U.S. except for Alaska and Hawaii. So we hope that you're having a great Wednesday so far. Thank you for joining the second in this four-part series of NACO webinars on maximizing the opportunities within the American Rescue Plan Act. My name is Jack Peterson. I'm NACO's Director of Strategic Relations. Very excited to have a great conversation today, and we're going to focus on health and human services resources within the American Rescue Plan Act. Before we get started, I just want to make sure you see the questions and chat box opportunity on the probably the right side of your screen. We encourage you to put the questions in there at any point. Also, we will have these slides available at the end of the presentation as well, if you have any questions on that front. With that, I'm honored to introduce two of our presenters today. First, we have Blair Bryant, who's our Associate Legislative Director for Health here at NACO. Blair's been leading NACO's health policy and best practices work related to COVID since February 2020. So we're very excited to have her here today. And secondly, we have Esri Garrity, the Chief Medical Officer at Esri, who is going to share some of the private sector resources, tools, information as well after Blair presents. So appreciate you all taking the time to join us today. And Blair, I'm going to hand things off to you.
Thanks so much, Jack, and for that introduction, and good afternoon to all of our attendees. Thank you for joining today's webinar. As mentioned, for today's presentation, I'll be going over funding opportunities made available from the American Rescue Plan Act signed into law earlier this year. So I wanted to organize this overview into distinct buckets of funding opportunities made available by the legislation. First, and perhaps most important, is the direct opportunities made available in the legislation via the state and local coronavirus fiscal recovery funds. Secondly, there is a significant amount of supplemental appropriations provided in the American Rescue Plan Act to fund local public health and prevention efforts, as well as other facets of the healthcare safety net. So I'll provide an overview of those investments, both under HHS as well as other federal agencies. And then I'll close out with a summary of current funding opportunities for local governments. So we'll start with direct funding opportunities as indicated, in which we'll be focusing on the state and local coronavirus fiscal recovery funds. The American Rescue Plan Act made unprecedented investments into local communities, providing $362 billion in funding for eligible state, local, territorial, and tribal governments, with counties receiving approximately $65.1 billion in direct aid from this pot. NACO has a resource center dedicated exclusively to the analysis and information on the state and local coronavirus fiscal recovery funds, as well as associated deadlines and a full overview of eligible uses, which I'll encourage you all to check out. We'll make these slides available to you, which has a link to that recovery fund resource page within the slides. So for the purposes of this webinar, I wanted to quickly provide an overview of the basic eligible uses of these funds, which are illustrated on your screen. So there's approximately 6 buckets in which eligible uses fall under. First is supporting the public health response. Secondly, replacing public sector revenue loss. Thirdly, water and sewer infrastructure, addressing negative economic impacts, premium pay for essential workers, and then lastly, broadband infrastructure. So I wanted to dive a little deeper in that first category of eligible use, which is the public health response. Many of you, if you have been on a NACO webinar, have seen this slide previously, but you'll find the 4 overarching buckets of eligible uses of the funding to support the public health response, as indicated in the U.S. Department of Treasury's interim final rule. So these 4 buckets include, first, COVID-19 mitigation and containment, and this includes a broad range of services and programming that's needed to contain COVID-19, as well as funds for vaccine incentive programs. Secondly, medical expenses. This is to provide care and services to address COVID-19 public health needs, as well as risk presented by new variants and long-term effects of the virus. Thirdly, behavioral health care. So this funding can be used to for new or enhanced state and local government services that may be needed to meet mental health, substance use, and other behavioral health needs of the community. And then lastly, public health and safety staff. So as we mentioned, there is an opportunity for premium pay for essential workers, but there's opportunities to bolster the workforce needs due to the impact of COVID-19 in the healthcare workforce. So moving into specific programs and projects, I like to think of these eligible expenses kind of in two ways. On the left, you'll see all things that have been associated with the normal public health response thus far. And then on the right, these are more non-traditional uses under the public health response category. So on the left, think about vaccination programs, medical expenses, testing and contact tracing, quarantine, PPE, as well as public health surveillance and enforcement of public health orders. So that's the traditional COVID-19 response efforts. And then on the right, you have things like enhancements of healthcare capacity, meaning you can do some capital improvement projects, support for prevention, mitigation, or other services in congregate living facilities, as well as schools, enhancement of public health data systems, capital investments in public facilities, like I mentioned, and then lastly, ventilation improvements. So those are kind of like your non-traditional health response efforts. And then moving on to kind of that overarching usage of behavioral health care needs. So the recovery funds can be used for several different services under this category to address ongoing behavioral health needs exacerbated by the pandemic, which include treatment for mental health disorders, substance use disorders, other behavioral health services, hotlines and warm lines. That's an important facet, especially as we think about 988 implementation coming next year, crisis intervention, as well as services or outreach to promote behavioral health care access. And then also I wanted to touch on the ability of to use these funds to address health equity. This is actually specifically spelled out in Treasury's interim final rule as an eligible usage. So this funding can be used to mitigate disparities in health outcomes through funding community health workers, funding for public benefit navigators to assist community members with applying for available federal, state, and local public benefits, as well as new or expanded quality childcare, home visiting programs, as well as enhanced services for child welfare, involved families, and foster youth. So I quickly wanted to go over some questions that we've received most often as it relates to eligible uses for the public health response. The first is, may recipients use funds to pay for vaccine incentive programs? So cash or in-kind transfers, lottery programs, as well as other incentives for individuals who get vaccinated? And the answer for that is yes. Under the rule, the interim final rule, recipients can use the recovery funds towards expenses related to COVID-19 vaccination programs, which include these incentive programs that we've been seeing popping up throughout the year. So secondly, how flexible are the categories in our categories 1 and 2, the public health response, as well as negative economic impacts when it comes to eligible uses? And the answer is that these categories and the usages under these categories is pretty flexible. As long as they can demonstrate that these activities support the public health response, or that recipients of the recovery funds have experienced economic harm from the pandemic, then it would be considered an eligible use. And then lastly, can recovery funds be used towards capital infrastructure projects if they assist in mitigating and containing the spread of COVID-19? And I mentioned this earlier, so the answer to that is yes. So there's actually been a number of funds allocated through supplemental appropriations for specifically that, capital investments for local health centers and hospitals, but particularly for the recovery funds, this is considered an eligible use, particularly if you're modernizing some of your county government or public facilities, updating that HVAC and ventilation system for the purposes of mitigating COVID-19, then that's certainly something that's an eligible use. So in this, I wanted to provide you with a snapshot of how other counties are spending their fiscal recovery funds. We actually do have a database on the NACO website that provides an overview of all counties that we've collected their ARP spending funds for. And if you click on this picture here, it'll take you directly to that database hub. So again, that'll be made available to webinar participants after the webinar. But for the purposes of this, I just wanted to give you a snapshot of some ways in which counties are spending these funds, particularly as it relates to the public health response. So in Skagit County, Washington, they have allocated $2.6 million towards launching the County Medical Reserve Corps, and that's going to assist with building up their healthcare workforce and responding to ongoing pandemic-related needs. In Contra Costa County, California, they've allocated $67.2 million for COVID-19 prevention and mitigation, as well as $22.4 million for treatment and medical services, including addressing gaps in care, so that health equity piece, as well as $22.4 million for addressing disparities in public health outcomes. In Frederick County, Maryland, the county is planning to allocate $12.4 million to address continued public health response, $3 million to address negative economic impacts, as well as $5 million for services to disproportionately impacted communities, and $30 million for revenue replacement. So that'll give you kind of an idea of how other counties are balancing these recovery funds with some other needs as it relates to pandemic revenue losses and recovery. And then lastly, in Tarrant County, Texas, they intend to use their ARPA funds, invest $51.5 million for workforce facilities and programs, and then $72 million for investments in public health infrastructure. So these are broad buckets and broad terms, but they can do a lot of things as it relates to the public health response. And again, like I said, that bucket in itself is flexible as long as you can tie it back to usages that address and mitigate COVID-19. So now I'll go into an overview on non-direct funding opportunities under the American Rescue Plan Act. I will start by saying that there was a number of supplemental appropriations made in the American Rescue Plan Act that support some of the direct funding that was released under the legislation. So a number of key Department of Health and Human Services agencies receive funding, a boost in funding for specific programs, and I'll just quickly give you a review of that. So the Centers for Disease Control and Prevention perhaps received the most amount of supplemental appropriations for various programs, including vaccine distribution, vaccine competence, testing and tracing programs, as well as programs to address health disparities and health equity, public health workforce expansion, and lastly, this is a new one that kind of came under CDC at the last moment. This announcement was made last week, I believe, for the nursing home and long-term care facility strike team. That program is being run under the CDC. So the funding is made available under this agency in two key ways. First, through new competitive grants, and secondly, through existing cooperative agreements. So I will say that the number of new competitive grants that come out of the CDC from American Rescue Plan, the American Rescue Plan has been limited. So I think there's only been about 1 or 2 opportunities for new competitive grants, which means that the majority of the funds are being distributed through existing cooperative agreements. And some of those cooperative agreements include the Epidemiology and Laboratory Capacity Program, which services approximately 64 jurisdictions. The Immunization and Vaccines for Children program, which again services approximately 64 jurisdictions, and the COVID-19 crisis response, which services approximately 65 jurisdictions. There's a lot of overlap in those jurisdictions as well, and there's only a handful of large counties that receive direct funding under those cooperative agreements. So a lot of that funding has to be sub-allocated from the state entity or whatever entity is the primary entity being funded under that cooperative agreement. So the next agency I'll provide an overview of is the Health Resources and Services Administration, or HRSA. And this agency got funding for programs such as the Community Health Centers program, the National Health Service Corps, mental and behavioral health training programs, teaching health centers, mental and behavioral health personnel promotion, and behavioral health workforce training programs. So this funding is made available to participating HRSA health centers, as well as the National Health Service Corps programs via non-competitive grants. So the funding is pushed out through the grantees of these various programs and these certified health centers under the HRSA Health Center program. SAMHSA was the other agency to receive a large pot of supplemental appropriations under the American Rescue Plan Act. So SAMHSA is obviously the agency in charge of the Substance Abuse and Prevention Treatment Block Grant, or the SAP Block Grant, and that received about $1.5 billion in a supplemental appropriations. This block grant actually is super useful in the local level for local governments. If the local government does not receive direct funding from this block grant, it is actually very easily sub-allocated from the state, and many counties use funding from this block grant to develop substance abuse treatment programs at the local level. Same with the Community Mental Health Block Grant, which also received $1.5 billion in supplemental appropriations. Money for CCBHCs, so which are going to be instrumental in providing a network for crisis response at the local level and ongoing inpatient and outpatient mental health services. Overdose prevention funding, as well as substance use disorder services grants and behavioral health services grants under this agency. So this funding was made available in two different ways. First is via service block grants, such as a SAP and Community Mental Health Block Grant, and then via direct competitive grants. So for example, the CCBHC expansion grant. So those are pushed out through existing funding mechanisms as well. And then lastly, just touching on one non-HHS funding opportunity that was made available last month. That was the USDA Rural Health Grants, and that provided $500 million to rural communities for either recovery grants or impact grants. And the grants would provide immediate relief to address economic conditions from the COVID-19 emergency, or to advance ideas and solutions to solve regional rural health issues. So this opportunity actually closed towards the end of October. So the funding announcement should be made relatively soon if you were able to apply for this funding opportunity. And then moving on to some current funding opportunities available for you right now. I know a lot of these streams have already been pushed out through competitive grants, or the funding has been released through existing mechanisms. So I wanted to leave you with some opportunities that you can access today. If you are in a rural community, there are several opportunities for funding for you right now through grant applications that are currently open. The first is the Rural Health Network Development Planning opportunity. And the purpose of this grant program is to improve healthcare in rural areas by supporting the development of new accredited and sustainable rural residency programs in all sectors of healthcare, including family medicine, internal medicine, preventative medicine, psychiatry, general surgery, obstetrics, and gynecology, as well as to address the physician workforce shortages that we're seeing all over the country. So this will provide $10.5 million in discretionary grants to 14 awardees, and the deadline to apply for this grant opportunity is December 20th. The second opportunity I wanted to highlight under this category is the Rural Public Health Workforce Training Network. And the purpose of this grant opportunity is to expand public health capacity by supporting healthcare job development, training, and placement in rural and tribal communities, particularly affected most by COVID-19. This program addresses the ongoing critical need in healthcare facilities for trained public health professionals, particularly again in rural communities. And this is done through the establishment of networks to develop formal training and certification programs in order to help professionals in the following workforce training tracks. So community health workers, health IT and telehealth, community paramedicine, case management staff, and respiratory therapists. So this is a forecasted grant opportunity which will open later this month. I also wanted to quickly highlight the Rural E-Connectivity Program, which is currently open, and it would provide 1.15 billion in discretionary grants to rural communities so that they can expand broadband access for the purposes of things like telehealth. We are closely watching this. This is a lot of money that's going to go out to rural communities for broadband efforts, and we encourage as many of our communities to apply for this grant as possible. The deadline to apply is February 22nd, so there is a large window of time to apply. And I believe there are a number of grant opportunities under this announcement. So this is a good one to look out for. So moving on to some public health and health equity grant opportunities that are open right now. The first one I'll talk about is the ARP Act Maternal, Infant, and Early Childhood Home Visiting Innovation Award. So this innovation award actually has two separate funding opportunities combined into one announcement. The first opportunity is around general data and technology innovations. And then the second opportunity is around COVID-specific related data and technology innovations. And the purpose of this award is to fund the development, implementation, and evaluation of innovations by the maternal, infant, and early childhood home visiting program recipients that leverage new technology or data collection and sharing strategies to improve that service delivery and extend the impact of early child home visiting services. So this program would provide $12 million to the grant recipients that are already participating in that program in the form of discretionary grants. And the deadline to apply for this opportunity is November the 26th. Then lastly, this one goes more towards health equity, and this opportunity is called the Promoting Equitable Language Access and Healthcare Utilization through Coordinating Centers. And this is a forecasted grant opportunity that would support the implementation of effective policies, programs, and practices to increase the use of prevention services through enhanced language access resource for populations with limited English proficiency. So this would provide $500,000 in forecasted discretionary grants, and the grant application post date is expected on December 17th. So I provided my contact information if you want any more information about what I've provided here today, but I'm happy to take questions at the end of the presentation. And I will now turn it over to my esteemed colleague, Esri, for her portion of this presentation.
Thanks, Blair. I appreciate that. And I will get my slides up and going here. That was a lot of amazing information. So I hope everybody got a lot out of that. I'm sure you did. And so I'm really happy to have this time to share information with you as we do collectively think about how this infusion of significant federal funding into health really has the potential to modernize our systems and better serve our constituents. And frankly, I just have to say, if you're not already excited or motivated, now is the time. Really, these opportunities don't come along that often. And what we're seeing with federal funding availability is probably along the lines of the New Deal or some other transformational efforts that I really think are going to help us leapfrog to a new dimension of public service delivery. So if you've had innovative projects in mind, but you just didn't have the financial means, wait no longer. Again, now is your time. And of course, I'm hoping that some of your grand plans include geographic information systems or GIS. So for my part today, I'm going to cover 5 areas where GIS can provide a lot of value to your plans for health and human services. And then I'm going to point out how these align with the available dollars that Blair has spoken about. But first, I do want to share a big picture view of GIS that I hope is going to set the stage, if you will, for some of the examples that I'd like to show you. So a geographic information system is more than a map. I say that a lot, but I want people to understand it's a comprehensive system, and it really enables all of the steps that somebody would need to take to accomplish a workflow. We can do things like measure, collect, and manage our data. And then we can visualize and map that data as we start to prepare for the analysis stage. And GIS has thousands, literally thousands of analytic tools that can really help us understand relationships and patterns that exist in our data. And those patterns really matter for our planning and our decision-making efforts. And then, of course, as we go to the action stage, probably my favorite stage, GIS really helps us to monitor our progress and evaluate how we're doing against our own benchmarks. We can communicate our results with stakeholders and the public as needed. And so what I hope you get from this infographic and what I'm talking about is that a GIS is a system. It's a system that enables the geographic or location-based approach to, in this case, health challenges. And I do also want you to know that today is International GIS Day, so it's the perfect day to celebrate that geographic approach. Now, so the first area that I wanted to talk about is the one that has been on everyone's mind for the last 2 years, and that is COVID-19 response and recovery. But COVID-19, as you think about it, is also simply the current representation of the needs for public health preparedness, obviously an ongoing program that will support the next crisis and the next one after that. And there are a lot of workflows in this area that GIS supports. I've listed just a few of them here. And in the next slide, I'm going to talk about those workflows from a geographic or GIS perspective. But before I get there, I want to mention that as you think about your needs in COVID response and recovery, as well as the future of your public health preparedness programs, you're going to want to be looking into the direct funding that Blair mentioned, those state and local government fiscal recovery funds. And in addition, I would suggest investigating the coronavirus capital project funding from HHS. They have several grant opportunities there that can be used to strengthen your preparedness infrastructure. So let's see how GIS supports this recovery and resilience work. As you know, the world has relied on configurable real-time dashboards to provide information from local to national to international levels on cases of disease, deaths, test positivity rates, vaccination rates, and much more. Dashboards are truly an integral tool for providing situational awareness for any emergency. Now, in health, it is particularly important to define vulnerability for the challenge at hand because it changes depending on what you're talking about. And once you have that defined, you can start to take steps to mitigate or eliminate inequities that exist in your populations. Now, with rapidly evolving situations, spatial and temporal analysis is really key to modeling the spread of disease and predicting infrastructure impacts like hospital bed capacity. And of course, then when our health system infrastructure is overwhelmed and additional capacity is actually needed, we can use GIS for site selection in ways that increase geographic access, can also prioritize equity and consider our budgetary and staffing constraints. So all of that in one system. Now, you might not have thought about GIS for doing contact tracing, but through link analysis methods and the methods born from graph theory like centrality, GIS can actually provide insights about not only the human-to-human spread of disease, traditional analysis that we do for contact tracing, but you can also gain insights about community spread, which does rely heavily on location information. Now, being efficient with your mobile workforce through things like optimized routing and apps that make your field teams more efficient is just another way that location intelligence can add value in this scenario. And frankly, maps and community hub sites are engaging. And because of this, they really help make your public health messaging more relevant and more interesting to your residents. And the next area that I want to cover is, maybe I'll say it's kind of a catch-all. We call it humans in crisis. And you're probably recognizing that, well, this topic could apply to all health and human services. In this particular case, I'm going to touch on 3 areas that are specifically supported by ARP funding: homelessness, opioid misuse, and food insecurity. So for homelessness, you're definitely going to want to look at Title III, Subtitle B, and the Housing Provisions section in the ARPA text. Of course, please also look directly to HUD, the U.S. Department of Housing and Urban Development, and their funding opportunities page. A big focus in the funding is a housing first approach, but other activities are also covered. And I do want to encourage those of you interested in addressing homelessness to also listen to the first webinar in this series. So just take a look at the NACO webpage and you'll find the recording of the Housing, Economic Development and Planning webinar that was just done 2 days ago on November 15th. So, okay, to find funding available for the opioid topic, look to ARPA Title II, Subtitle H for Mental Health and Substance Use Disorder Initiatives. And also, of course, Blair mentioned it, don't forget to go to SAMHSA grant announcements page. That is, again, the Substance Abuse and Mental Health Services Administration, SAMHSA. And if food insecurity is your priority, then you're actually going to want to check out Title I and Subtitles A and B from USDA. They're supporting a bunch of nutrition programs, as well as Title II, Subtitle C for Human Services and Community Supports. Now, here are some examples of the GIS workflows. I'm going to start with homelessness. We are encouraging everybody to modernize the homeless point in time count. Not only is that going to make your data more accurate and speed up the analysis stage, but now you can actually monitor the progress of your count in real time. And why is this important? Well, this is it's going to allow you to engage your partners that can step in and provide services to people identified as homeless right away. Now, we've also formatted the report that you would need to send to HUD so that you can send all of that required data immediately at the end of your count. So it's automated. You don't have to scramble to put that together. Now, GIS is also great for analyzing the complex set of factors that contribute to creating homelessness. I mean, the causes, as you know, are variable and often multifactorial. And that analysis stage for those risk factors can really help you put the right supports in the right places for your populations. And if you are involved in decisions around housing, GIS can help with suitability analysis, as well as 3D visualization of community impacts for where you decide to place housing. Now, for managing the opioid epidemic, we believe that a large part of the public-facing effort is overcoming stigma and just talking about it. Story maps that share how the epidemic is affecting your community can really help, as well as crowdsourced tools that allow people to share more personal stories that I believe increase empathy and often can mean more and inspire more action than raw data and statistics alone. It's also critically important to ensure that people know what kinds of resources are available to them and how to find those resources in a way that's most convenient to them at the time they need them. And then you'll see in the lower right corner, I am showing an example of where we've partnered with organizations that use a geographic approach to do wastewater monitoring of opioids and their metabolites. And this acts as an early surveillance indicator of increasing opioids in a community. GIS is a great tool for this growing area of wastewater epidemiology. Now, when it comes to food insecurity, basically what you need to do is understand where your healthy food options are and their level of accessibility by your residents. When you find gaps, or what we call food deserts, they're going to become really obvious, and so you can start making plans to step in exactly where needed. Now, the concept of access to care and services is universal in health and human services. Lack of geographic access is an important cause of health disparities. And for this work, I know it cannot be effectively done without using technology. You would lose accuracy, and that, of course, can mask disparities. So how can you get this work funded? In some ways, I would say it should be relatively simple, because the concepts of access to care and health equity are cross-cutting, and they apply to most of the funding opportunities out there. So as an example, the direct funding approach can support your ongoing COVID-19 work and help you build this capability of defining and calculating access for the purpose maybe of improving access to vaccines or for testing sites, but then you can expand that across your other programs for which this is important. So how might this look with a public health example? Let's say that you map your population of low birth weight babies, and maybe you even perform some analysis. Maybe you do a hotspot analysis to find the statistically significant areas that are experiencing high levels of low birth weight babies. Then you might map, let's say, all of your OB/GYN specialists and determine a 30-minute travel time boundary around each one of them. Well, with that, I would do what we call map subtraction of those first two maps, and you're then able to home in on the specific parts of your jurisdiction for which a lack of specialty care might be a part of the problem. And again, when you have that information, it becomes more clear what you should do about it. Now, of course, the work isn't over. Once you have that information, you do have to do something about it. Sometimes we have to find creative ways to fill access gaps. So you might hire additional providers that could serve the area, or maybe you want to site a new clinic that increases access to care in those underserved areas. But you might find that there are other barriers to access that aren't quite as straightforward as just getting in a car and going somewhere. It could be that people have a higher travel burden because they are reliant on public transportation or have various disabilities that make it difficult for them to get from one place to another. So maybe you'll be able to provide ride-sharing options to support increasing access, or maybe you'll support telehealth services. That's an area that I'm going to speak to a little more shortly, and certainly has lots of funding behind it. Now, the fourth broad area that I wanted to cover is strategic planning. Again, this is a cross-cutting and area, and I think you could argue that probably everything that you'd like to accomplish with federal funding includes strategic planning. Point well taken, I get it. The reason that I'm mentioning it separately is because we do have some special software and data that specifically supports this use case, which of course then is repeatable for all of your initiatives across your departments. Now, that software package, by the way, is called Business Analyst, and through it you would have widget-driven workflows that make things like site selection really pretty simple, and you have over 15,000 data variables down to the block group level that could make your planning much easier, including at least 2,200 demographic population level variables. Okay, so when you're making those big strategic plans, the last thing that you're going to want to do is waste time or money. So the focus here is really on providing evidence or the data that you need to increase your confidence in these big strategies or big spends potentially that you want to do. Now, you might want to explore how demographic shifts are impacting your populations. With COVID and remote working and the Great Resignation, things are changing fast. And we can't always wait for the census to get the data we need for decisions. So this graphic I'm showing here uses anonymized cell phone data to see some level of migration patterns. Now, as you expand a line, and maybe even you need to deprecate some services that you're providing, you may have many factors that should contribute to your decisions, like many factors, but humans actually can only consider 4 to 5 factors at a time cognitively. So we really do need computerized decision support to ensure that we've included everything that's important to achieving our goals and making the best decisions. Now, let's say that you want to take advantage of the funding to expand telehealth services. I said I'd talk a little more about that. You might do things like assess access to care for your population. So, you really want reasonable telehealth options for places where there's low access. So then you might go and determine if the broadband coverage is adequate to support providing virtual care. If it's not, apply for the grants that Blair mentioned. And you may even examine then the population's key health concerns so that you can pull together the right specialists, the right workforce, and recruit them to provide the telehealth services that are needed for your population. And in the lower right, simple as it is to say, sometimes you just need a report or an infographic that you can customize for your needs that give you an overview of some area of interest, whether that is a municipal boundary or it could be some custom boundary like 30 minutes around a health system. Now, the last category I wanted to mention is health equity. In health, we have discussed the social determinants of health for decades. We've focused on developing our understanding of these factors and how they might inform actions. Well, it turns out that a geographic approach to health equity is powerful, and it's actually a rather natural approach to this issue. So let me show you. You can now do community health assessments digitally and quickly. The apps that we provide for this can be used for the regular public health community health assessments. They can be used for rapid health assessments using the CASPR framework and for the community health needs assessments that hospitals need to do. Dashboarding apps are going to pop up again and again in health. For this theme, they pop up for local governments to be able to share information with constituents. You could do things like use dashboards to monitor key indicators, like how well the government workforce represents the diversity of the community. And while it's important in all health programs, I think that community engagement for purposes of building equity is perhaps one of the most important areas. So we have the Community Health Outreach Solution, which is a collaborative hub site, and also resource locators that can really help support some of that engagement and both unidirectional and bidirectional communication. So I know that was a lot of information. I went through it pretty quickly. Blair and I had a lot to share, but the recording will be available for this webinar. And also I would encourage you to go to our stimulus funding page that's shown here. Now on that page, you will see resources for Health and Human Services, including 2 blogs that I've written, and they have lots of links to the funding opportunities, to the NACO site, as well as all of the things that I mentioned with title this and subtitle that. It's all in there, so if you missed it, that's fine. And there are links to all of the GIS solutions and more that I covered today. And I'll also point out that in this series, there are 2 more webinars we want you to be aware of. The next one covers transportation and transit on December 6th, and then we'll have one on broadband. So if you're thinking telehealth, don't forget that one. That'll be on December 8th. Now for today's webinar, I just want to put a pitch in there. There is going to be a post-webinar survey, And I just want to make a really sincere plea. Do fill that out. It only takes a couple minutes. This particular topic is broad. It is difficult to cover in a useful way for you. And so we'd love to hear your suggestions. Was this useful? Are there other things that we could do that'll make it useful for you? Please send those back to us. And you can also send questions directly to me. This is my contact information. And with that, I'm going to turn it over to Jack, but I'll put the resource slide up first, just saying my email is egarrity@esri.com, so you don't have to look at this page, but you should definitely look at the stimulus funding. Okay, so back to you, Jack.
This is Richard Ledbeater with Esri. Jack had to peel off many meetings in the day.
Thanks, Richard, for stepping in.
I think you answered a lot of the questions. All the questions that came in, you eventually answered. So I applaud you for that. It was a lot of information, and thanks to the audience for holding on to the ride. Question to you, Dr. Garrity, is what future events are you in particular planning around with your health team in the next couple of months? This was a lot of information. It's going to be a lot to apply. The bill alone, I think, was 1,200 printed pages. Are there future events coming up where you and the Esri Health team will be exposed to ask questions?
Absolutely. So that's great. We have probably the big one coming up. I'd encourage everybody to go. It's going to be one of the early times that we get together in person. So hoping all goes well. That is our Fed GIS conference. That will, of course, be in Washington, D.C. And although it is called Federal GIS, for the last several years, we have welcomed state and local government members to attend. And we will have 2 sessions related to ARPA and other funding, one that I'll be doing. So I'll have an hour and I'll expand on a lot of the ideas here today. And another one that's going to look at this from a more of a grant management perspective. So I think that'll be really interesting to see how the tools can be used in that way. Then I would have this is a little bit in advance, but it's never too early to mark your calendar. For May 3rd through 5th of next year, we will have our Esri Health and Human Services Conference that will be in Redlands at Esri headquarters. So if you ever wanted to see what it's like there, it's a great opportunity to come and enjoy our beautiful campus and learn more about health. No doubt we'll be talking about grant funding there. I'll also quickly mention, although it's not an event, I will be adding a 3rd blog to my series of blogs. And again, if you keep watching that stimulus funding page, there's going to be lots of materials added to there because this is a very current and important topic. So lots of folks are really focused on getting you the information you need on that site.
With that, I think we're at the end. No more questions are coming in. Anything else to add, Dr. Garrity, before we log off?
Just that we're here to help. And, you know, I know grant writing from experience wasn't my favorite thing, but we have some great writers at Esri. We have some repeatable patterns. And if we can help you with the GIS language that supports the work that you want to accomplish, we're happy to help with that. We're happy to provide the technical papers and the things that are going to make it easy for you to accomplish your goals. Because like I said in the beginning, to me, this is a huge opportunity. We all regret, I think, and dislike the pandemic and the situation that we've been in. But what an eye-opener. It's exposed what we need to do to enhance and strengthen our systems. And now there's funding available to do that. So my view is that the opportunity in the next, I'd say 3 to 5 years, to leapfrog to a whole new stage of public health preparedness and public health response in all of our programs is enormous. So don't miss the opportunity and let us help if we can.
Right, thank you, Doctor, and thank you to Blair Bryant and all of the NACO staff for putting together the resources that were referred to on earlier in the call. Just a reminder, this was recorded. It will be published. Give us a day or two to get it up back onto the web. But thank you for your time, and please submit questions. You have our contact information. We would love to be able to respond to any particular needs or wants that you have. Thank you.